Ladies and gentlemen, thank you for very much for joining one of our sessions tonight or today. I'm so delighted to be the moderator of one of our specialized sessions in our Mega Online Academy or course in anesthesia and in ICU as well. This session actually includes a couple of interesting topics that are going to be discussed on the floor, would be presented by one, as usual, by two of our reputable speakers who really granted with a very professional background, a very professional qualification as well. Today, we're going to discuss a couple of topics. One of them are slightly basic, but it's very important, and it's one of our really daily practice, been really touching our daily practice. It's about the ultrasound physics, and the next lecture will be about one of the advanced approaches in our, that we see in our ITU or in our intensive care or in our cardiac anesthesia, and currently in during the COVID era as well, about the ECMO. But allow me first, on the behalf of you, to welcome our dear speakers tonight, and welcome Dr. Nabil Asqalani as well, Dr. Saad Mahdi, and our dear speakers, Dr. Walid Shibl and Dr. Muhammad Hamdi. I will start first with to introduce Dr. Walid Shibl, and Dr. Walid Shibl actually have a huge record of national and international qualification in the field of the intensive care, and really he's an instructor in many of our famous approaches in anesthesia and of critical care, like PLS and ACLS as well, and REF support programs. Dr. Walid Shibl is an ICU consultant in the Maadi Medical Complex, one of the center of excellence in the management of intensive care in the lovely Cairo in Egypt. You have a long record of certificates and qualification in the echo experience as well, and definitely he's going to be the best speaker attaching and discussing the physics of the ultrasound, and definitely based on his approach, definitely it will be very easy for us really to acknowledge that he will be able to give us really a very good and very informative speech about it. And perhaps you know that currently the ultrasound now became like one of the main tools and one of the main methods that have been used in anesthesia as well as intensive care. So welcome, Dr. Walid, and definitely I hand over the mic for you, and probably will be very, all of us will be very interesting to hear the rest of the talk from you.
Thank you a lot, Dr. Haytham. Thank you all. I hope to learn from each other and teach each other this night.
Over to you.
Okay, thank you. Today we'll talk about the ultrasound physics made easy. We'll try to talk about very important concept, help us during doing this beauty maneuver. Ultrasound is a mechanical disturbance that moves as a pressure wave through a media. Mechanical disturbance that move as a pressure wave through a media. Please don't leave, don't leave. We'll try to be simply, okay? This manual experiment, I believe, will orient you about what this hard physics word. Ultrasound is a mechanical disturbance that moves as wave through the tissue. Mechanical disturbance that propagate as wave in tissue. Here in water and here in soft tissue. It's a mechanical disturbance lead to wave propagation in tissue. This is really the ultrasound. But please, attention please, in ultrasound, this happens at the molecular level and in very high frequency and speed. It's not a couple of waves per second, it's a millions of waves per second. But at the end of the day, it is a mechanical disturbance that lead to a wave propagation through the tissue. This is the ultrasound probe, will lead to mechanical disturbance of the tissue at the molecular level will lead to a disturbance of the tissue and lead to condensation of the molecules. And this condensation will lead to increased concentration of the molecules. And by increasing concentration, this molecule will move by concentration gradient. And while moving will lead area of decreased condensation of molecules here. And this is called compression and rarefaction, like spring, compression and rarefaction. It is a mechanical disturbance at a molecular level, lead to movement of the molecules on longitudinal wave through the tissue. This mechanical disturbance will lead to condensation of the molecule, which will move through the tissue by concentration gradient and will leave a rarefaction, an area of less density of the molecules. With condensation, there is upright and positive wave, and with rarefaction behind will lead to negative wave. And this is the ultrasound wave. As you see, the ultrasound wave has wavelengths from beginning of the wave to the end of the wave. This is a wavelength. And the ultrasound wave has frequency, number of waves per second, hertz, 1 wave per second, 1 hertz. This pulse is 2 waves per second. That means frequency is 2 hertz. And as you see, this is the wave length of the ultrasound. Suppose this is 1 centimeter and we have 2 waves per second. We can measure the velocity, which is 1 centimeter plus 1 centimeter per second, يبقى 2 centimeter per second. This leads to very important equation, which is velocity of ultrasound equal wavelength multiplied by frequency. As you see, if we increase the frequency, the wavelength will decrease. If we decrease the frequency, the wavelength increase. But remember, wavelength velocity equal wavelengths multiplied by frequency. And the audible sound frequency is from 20 to 20,000 hertz, but diagnostic ultrasound need 2 to 15 megahertz. That means reaches up to 15 million cycles per second. As all of you know, the frequency is stable, emitted from the transducer is a stable frequency. So the variation of the ultrasound velocity will not depend on the frequency, which is a stable number, but will depend on the wavelength. And what will determine, this is very important, please, what will determine the ultrasound velocity in tissue and the ultrasound wavelength is the tissue type. Tissue type is the cornerstone of ultrasound physics, because tissue type will determine the most important parameter of ultrasound, which is the velocity. Okay? As you see, if the tissue is compact, like liver, kidney, spleen, with compact nearby molecules, it's very easy to displace these compact nearby molecules and will lead to very high velocity, which is equal 1,540 meters per second in parenchymal organ, in compact organ. But in air, because there is dispersed molecules, very difficult to displace these molecules, and you will get very low velocity, 330 meters per second, and in liquid will be in between. But remember, 1,540 meters per second is the velocity of ultrasound in most soft tissue and in the blood. Very important figure. This is very important. You will use the transducer, you will apply the transducer to your patient, and you will see an image. What is the mechanism of that? The transducer, which you use in ultrasound, will emit the ultrasound wave and will receive the reflected wave from the tissue. And most of the time, the transducer is receiving reflected wave. And the emitted waves from the transducer will go through a nice journey through the tissue and will be different reflection. And remember, the reflected wave from different tissue will come back to the transducer. The transducer will transform this reflected wave to electricity, and the beauty machine will convert this electricity to an image which you see in the screen according to rules. What are these rules? Concept of reflection. The image you see in the screen is the end result of reflection, of reflected ultrasound waves. It's very important to know about the concept of reflection. Ultrasound machine will translate the reflected wave into image. If the reflected wave is too much, the appearance in the screen will term it hyperechoic or white. So bones has high density tissue, and because of this high density, the amount of reflected wave from the bones is too much and will appear as white. As I just said, type of tissue will determine everything. Here we see the bone, which is too much in density, will lead to hyperechoic image. The same situation for pericardium, which is the high density and a lot of fibrous tissue, will lead to high reflection and will appear hyperechoic. But if the tissue has very low density, like water in urinary bladder or blood in inferior vena cava, as you see, the reflected wave will be very poor and will appear anechoic, black. And in between the bone and the water is a tissue like liver, like mass here in the liver, like kidney. There will be a moderate reflection because of moderate density, and the appearance will appear as hypoechoic. So according to the reflected wave, you will see the image in the screen. And this determined by the type of tissue. Type of tissue, this density of tissue will be translated by ultrasound word to echogenic, hypoechoic, or anechoic plaque. So first, density of the tissue will determine the reflected wave and will lead to the different echogenic pattern. Number two, the number two very important rule, how the machine work to construct this image. The first rule, it will determine the echogenicity according to the tissue. Like this gallbladder has anechoic bile and hyperechoic stone, and this according to the density, bile very low density anechoic and stone high density white, and the liver in between. But why the stone appear 5 centimeters from the skin and the skin appear 1 centimeter and bile in between? What is the rule govern that? Ultrasound machine software translate the delay in type of reflected wave into depth. Look for this ultrasound image. This is the skin. Skin appear 1 centimeter from the surface here. Because the reflected wave from the skin reach to the transducer very fast, and the transducer translate this time to depth. So if, and the stone here appear 5 centimeters from the surface, because the reflected wave from the stone take much longer time than the reflected wave from the skin. So intelligent probe will translate the delay in return of reflected wave into distance, into depth. And why is that? Because this intelligent transducer has two important information. First one, he knows the velocity of the sound. Suppose the velocity of the sound is 1 centimeter per second. And at the same time, this intelligent transducer can know the time of return of reflected wave. So the reflected wave from the skin reached to the transducer in 1 second. And he knows the velocity is 1 centimeter per second, so he will put the skin in depth of 1 centimeter. The time of reflected wave from the stone is 5 seconds. So he will put the stone 5 centimeter in depth. By translating the time to depth, the ultrasound picture will be constructed. Number one, according to the density will appear the echogenicity, and according to the delay of reflected wave will appear the depth of the organ or the structure. These two rules very important in governing of ultrasound image you see in the screen. So how can you use this physics in daily practice? Number one, please try good reflection. Because of that, try to be vertical as much as you can. In the organ you need to explore. Try to get a very 90-degree angle to get a very good reflection. Because good angle, good reflection. Bad angle, very bad reflection. Okay, second, this another important rule in ultrasound physics you need to know. We first know about the density of the tissue, which will govern the echogenicity of the structure you see, and how the ultrasound will put the organ or tissue according to the delay. And this very important another concept. There is, as I said in the beginning of the lecture, tissue type will determine everything in ultrasound image. Artifact, echogenicity, everything. The rule here, if you have an interface like pleura here, and this interface is between two tissue. If these tissue are different, this will govern the reflected wave to great extent. Let us explain that. Each tissue in the body has what's called acoustic impedance. Acoustic impedance is the resistance of the tissue to the ultrasound. And each tissue is different than another by this acoustic impedance. Okay, let us see this important rule. We have a pleura here. This pleura separate two tissue, soft tissue and the muscle, superficial, and the air in the lung, deep. Let us see the acoustic impedance, the density, the type of tissue in both sides of pleura. The muscles here has acoustic impedance of 1.7, and the air has acoustic impedance of 0.0004. So there is too much discrepancy between the two tissue in either side of the pleura. What does it mean? The rule is saying if there is more discrepancy between the tissue in the interface, there will be very high reflection. So all the sound in the pleura here will reflect back to the probe. And because there is too much reflection, it will rebound to the pleura and reflect back to the probe. Rebound to the pleura, reflect back to the probe, and will give these repeated air lines, which is famous in lung ultrasound. So the type of tissue in between the interface will determine everything, will determine the reflection, will determine the penetration, will determine the refraction. Everything will be determined by the type of tissue in between, separated in between the interface. So this image, the ultrasound here will face the bile, which is the water. The water acoustic impedance is 1.5, and the stone, which is very hard, like bone, 6. So there is too much discrepancy between the bile and the stool. So the ultrasound wave will be reflected too much. This too much reflection will lead to hyperechoic stone, and no sound will pass behind the stone, so will appear as black or shadow. So as you see here, the type of tissue between the interface will determine the image you see, which is a hyperechoic stone, and the artifact happened, which is the acoustic shadowing. And this all over the ultrasound images. Attention, please. We talk about the concept of reflection. We need very good reflection. We need, and why we are using gel? We are using gel because we need to improve the acoustic impedance, the discrepancy between the gel and the skin is very proper for ultrasound movement than between pockets of gas and skin. So we are using the gel to enhance this harmony and discrepancy between the different tissue. So we'll repeat. Concept of reflection, we need good reflection. We'll use the gel and we'll use vertical angle to get good reflection. And according to the density of the tissue, you will see the image in the ultrasound. If too high density like bones will appear hyperechoic. If too low like water will appear anechoic. And the depth of the tissue will be according to the delay in the transfer of reflected wave. And you know now the acoustic impedance of the tissue and how the difference of acoustic impedance will determine the artifact like shadow and the appearance of the tissue. Now, it's not only reflected wave. At the end of the day, we need the concept of penetration. We need the ultrasound wave not to be reflected here and appear only the skin or the superficial part of the liver. We need the ultrasound wave to penetrate deep to see the spleen and the fluids in the splenorenal pouch and the renal capsule and the renal fats and even the intestine in the other side. We need this very good penetration. So while I'm doing the study, I need to think of reflection and think of penetration. I need to go deep to reach to the structure of interest. Unfortunately, the energy of ultrasound beam is gradually reduced as it passes through the medium. This reduction is termed relaxation energy loss. The rate at which the beam energy decrease is a reflection of attenuation properties of the media. This is another concept. You need to know the tissue is determining everything. And there is what's called attenuation coefficient. the ability of the tissue to attenuate and absorb the ultrasound. Okay, and as you see here in skull bones, it is 20 decibel per centimeter. For every centimeter through the skull bone, the ultrasound beam will lose 20 decibel, too much. So you need to know this concept of penetration and the different types of penetration according to the tissue to help you doing the ultrasound procedures. For example, you need to avoid the ribs while you are doing lung ultrasound or heart ultrasound. You need to avoid the ribs. In the skull, you need to go to the temporal bone, where the bone is very thin and you can go through. So you need to know, you need to facilitate the ultrasound to penetrate the tissue and avoid the tissue with high acoustic attenuation coefficient like bone and like lens. If you are going to do optic nerve sheath diameter, you need to avoid the lens because the lens of the eye has very good attenuation coefficient. So I need to use the water because the beam after the fluids is, as you see here, there's enhancement. There is very good amount of penetration of beam here. And through the fluids, I can see everything. But I need to avoid the fat and the air and the bone because it scatters the ultrasound waves. So here, as you see, I am using the lever to see the inferior vena cava because lever is good media I can go through. But inferior vena cava may be a hill if there is a lot of gases, as you see here. And attention, please. The loss of ultrasound intensity during penetration depends on the frequency of the probe. 1 megahertz ultrasound beam, 1 megahertz probe will lose 1 decibel per centimeter penetration. But 2 megahertz will lose 2 decibel. So the high frequency probe with 15 megahertz will lose 15 decibel with each centimeter. Because of that, high frequency probe has very bad penetration. Don't examine the heart or the lung by high frequency probe, but you need to examine superficial structure like blood vessels. And very important rule, you need to know high frequency probe is good in resolution, but bad in penetration. Low frequency probe is good for penetration, but bad in resolution. To sum up, you need, while you are doing the ultrasound scan, you need to think of concept of reflection. You need to have good reflection by applying good gel, by applying good angle, by avoiding the bad interface, and at the same time, you need to target good penetration to avoid the tissue with high attenuation coefficient like bone, fat, gas, and at the same time to use the suitable probe, which is a low frequency probe if you are going to examine deep structure in the abdomen or heart, and use high frequency probe while examining superficial structure like blood vessels. We finish about the ultrasound as a B mode, as an image mode, as acousticity, 2D. But now we'll talk about ultrasound as a Doppler. Please forget about B mode now. We are using ultrasound as a Doppler for another issue, which is to explore the direction and velocity of blood flow. So we are targeting the red blood cell, moving red blood cell inside the blood vessels. Very simple equation, Doppler equation, very simple. As I just said, we are targeting the velocity of ultrasound, the velocity of blood inside the vessel. This is our target. By using Doppler mode, I need to explore the direction and the velocity of blood inside blood vessels. The equation, Doppler equation, said velocity of the blood, red blood cell inside blood vessel equal C, which is the velocity of the sound in the blood, fixed number 1540 meter per second, nothing to do, it is fixed number, over 2 multiplied by frequency of the probe, nothing to do, it's fixed. You cannot judge or control the frequency of the probe, it's fixed number, multiplied by cosine of the angle of insolation, multiplied by frequency shift. So velocity of the sound in the blood fixed, frequency of the probe fixed, frequency shift fixed, nothing to do with, and we'll know what is this frequency shift. So the only rule you have in Doppler is you adjust the angle. You need to make this angle as low as you can. You need to be parallel to the blood flow to get the real velocity. But this is very difficult to go inside the blood flow. So at least if you use the angle, try to decrease this angle as much as you can. At least in blood vessels, it is up to 60. In cardiac examination, it is 30, decrease to 30, okay? The cosine of the angle 0 is 1, and this is the best angle is 0, but at least try to decrease the angle as much as you can, and this is your rule. Nothing you can do with the Doppler apart from adjusting your angle, and as you see, all the equations are fixed number you cannot control. Let us talk about the frequency shift. I am targeting by Doppler the red blood cell. If this red blood cell is here, the probe will emit fixed frequency. This is the emitted frequency targeting the red blood cell. If this red blood cell is moved away from the probe, so the reflected ultrasound beam will spread. By means of spread, that means there is decrease in frequency. So the frequency coming from the probe, which is the emitted frequency, is more than the reflected frequency from the moving away red blood cell. And this is the frequency shift. Is the difference between the reflected frequency and the emitted frequency. And as you see, if the reflected frequency is less than emitted frequency, the spectral Doppler will appear below the baseline. Okay? But if the probe is here, and this is the emitted frequency, and the red blood cell is coming towards the probe, this will lead to condensation of the waves, and this means increase in the frequency. So the reflected frequency will be higher than emitted frequency, and this is the frequency shift. And the famous example is the ambulance frequency of the sound of the ambulance series. If the ambulance is coming towards you, while coming towards you, the intensity increases. But if it's coming away from you, the intensity and the frequency decrease of the sound of the ambulance, okay? This is the frequency shift. And this depends on the velocity of the ultrasound wave, okay? There is color Doppler. The software in the machine will translate the flow of the blood towards the probe by red color, and move to the blood away from the probe will be translated by blue color. So my probe is here. This is the middle cerebral artery. The flow is towards the probe will appear in red, and the frequency, reflected frequency, will be higher than emitted frequency. So the spectral Doppler will appear above the baseline. And here, the blood flow through the anterior cerebral artery is away from my probe. So the software of the machine, the color, will translate that in blue and blue the baseline. If the velocity of the ultrasound, if the velocity of the blood in the blood vessel or the frequency shift is more than this scale, will appear, the software in the machine will appear the color as aliasing, which is grades of light yellow, light blue, and light yellow. This means there is high velocity in the sound. I believe this is ultrasound physics made easy and in form of concept, important concept to apply and to remember while you are doing your study, and in a very simple way. And I'm happy to receive any questions about this issue. Thank you a lot for your appreciated listening. And this is my Facebook page, professional Facebook page, Hands-on Critical Care Ultrasound Courses, and this is my YouTube channels. And I will be so pleased and happy to visit my sites. Thank you.
Oh, thank you very much, Dr. Walid. Really, it's a very informative and illustrative or one of the main topics that actually currently became one of the main endeavors in our clinical daily practice. Let me say it's one of the cornerstones of the clinical decisions in the, not only in the theater settings, but even in the ITU as well. I believe that this lecture will go beyond being a normal presentation to be kept in the archives of all of our colleagues, especially the trainees, the junior doctors. Really, it's a very illustrative because this topic, I believe that it really been attractive for all the gray hair examiners, for all the people being really enrolled in exams in the anesthesia or in the ITU. I have a couple of questions for you. Let me start with the first question. What are the value of mechanical index or thermal index? And what are the buttons responsible for those adjustments?
The button responsible for this adjustment is the power. It's the power. And if you decrease the power to 10%, you will decrease the mechanical index and thermal index. And please, this mechanical and thermal index is very important while you examine the optic nerve sheet, because examining the eye, there is no bone to help to attenuate the ultrasound. So in this way, you need to decrease the mechanical index to below 0.02 and decrease the power to 10%. Unfortunately, don't worry, this will not affect the brightness of image. Some people are afraid to decrease the power because fear of hazy image. No, don't worry. But please, while examining the optic nerve sheet, you need to decrease the mechanical index and thermal index. Drop the power to 10% for sake of safety, because we should use ALARA concept, which is as low as you can to assess your.
Well, thank you very much. And the second question is, what is, the best for the image adjustments using the harmonic button or the gain button?
Really, it is, if you are talking about the clarity of the pictures, harmonic button, okay?
Harmonic.
Harmonic, because harmonic button, now new machines use the harmonic. What's meant by harmonic? We talk about the concept of reflection. Reflected wave, this will judge and will control the image in the screen. Good reflection, good image. Okay, good reflection. The harmonic image will double the reflected wave. Yeah, simply harmonic modes will double the reflected wave. I use the harmonic mode in transcranial Doppler. And the inventor of the transcranial software, they didn't put the harmonic wave with transcranial. I use the phase array and I press the button harmonic. And the image is completely different because the skull interfere in the transcranial Doppler. So harmonic mode is better in imaging, in cardiology, and in transcranial. الجين will increase the gain all over يعني will not affect your but harmonic will يعني if you increase the gain or decrease the gain you will control the image but not to the extent of doubling the reflected wave. This is
okay, so it's more for more clarity.
More clarity. And now all
Yep.
the machines, I know some machines now all harmonics. When you
Yep.
use a Kartek, it's Kartek with harmonic, and this is a problem. I buy my machine when I talk with the engineer. If this happens something with harmonic, and this would be a disaster. قال لي لا don't worry it's software but this is very problem because you used to use harmonic mode and it will increase the brightness and the image, and if there is problem with the harmonic mode the will be a hell, the image will be a hell. Okay, the harmonic
Definitely. Yeah, it seems really it opens a lot of discussion. So another question should be always I mean the clinician or I mean whoever applies the probe should be always perpendicular in the 2D mode ultrasound or should be parallel in the Doppler wave. I mean, which is most appropriate.
This is for myself. This is the fine tuning, and this is a fine tuning. This comes with experience. Fine tuning means you need to get the most suitable angle to get the most better image, to get the best image. And if you get the best image, you can interpret this image. Yani, the experience come from this, not in interpretation. Because if you see the vegetation, this is the vegetation. But how can you bring this vegetation clearly in the screen? But try to be vertical as much as you can, and during Doppler try to be parallel as much as you can. This is and this is experience. Try to avoid the rips, avoid the fats, and they rotate, knock, tilt, and try to get safe.